Yeah, good morning. Actually, this is an extrapolation of a modification which we came out with while treating a lot of trochanteric fractures in the elderly with lateral wall break. So we found it challenging. So we actually modified the conventional DCP where the proximal two screws were widened, and we used to use the plate and get the proximal screws through the plate into the head and neck. So let's go through this case. It's a 10-year-old child with a Delbert type 3, and this was fixed like this and with it's a 6.5 mm screw. Looks smaller on the X-ray, but it's a 6.5 cancellous screw. It was done here very much in our institution. If you look at the reduction, the alignment looks reasonable, but definitely there is some amount of malreduction. Fixation, I feel that it is not stable enough, and it went on to a varus collapse at 6 weeks. But luckily it united. At 3 months, it united in varus, but this is not something which you want to see when you treat a child with a fractured neck of femur. And this typically happens in Delbert type 3 fractures. And you should remember that good reduction is important, but it cannot compensate for a stable fixation. And if your fracture line is vertical, more so, I feel that there is a need for a side plate to prevent varus collapse. So this is the 7-year-old child who had a fall while playing, and this is the same patient which we demonstrated yesterday. So they have used a side plate here, but I think it is not a good idea to use such a big implant in a small child, which essentially removes a lot of bone in the neck. And at 6 weeks it has collapsed. So how do I manage in these children between like 6 and 10 years of age when we get this fracture, where we feel even a pediatric DHS is a huge implant. So this one, on table after traction, we got a decent reduction, and this is actually a conventional 4.5 DCP, and we use the 6.5 screws across the fracture, get a good compression, and put 2 screws distally. We don't have to do an extensive opening. You can do through a small incision, like routinely what you use for your cancellous screw fixation of neck of femur. And I feel that it definitely works in preventing the varus collapse. This is a post-operative X-ray. I think Sandeep is using a 1/3 tubular plate with the same technique, I guess. All varieties of plates. And this is the 1-year follow-up. So this is a small trick which I thought will be useful for you to know more. Particularly when you don't have the proximal femur locking plate. This is a simple implant which is routinely available in your inventory. You can use to fix the femoral neck fractures. I'm done. Thank you.